See how it's clear through there? And when it's locked, it's blue all the way through. So I can do like this and nothing's gonna come out. If I did like that, like this, it's gonna pour out. And I'll show you that in a minute. So it's hanging on the side of the bed, like this. So about how much do you see hanging?
400.
About 400, right? Can I have my container back? So this is hanging on the floor, and we're going to say, okay, that's about 400, but never don't do it like this. Measure it in a graduated container so that we'll be able to see. So now I'm gonna hold it over, and I'm gonna open it up. And you're gonna have to turn it like this because it won't fully empty like that. You just have to turn it.
So doing it that way, you only want to do that for like outtake or output.
This is intake and output. Okay?
And then for your samples, we do like what she taught us and get it from the get it from the higher, not on the back, right?
It's a whole different, that is a sterile technique. This is not.
Okay.
This is just measuring output. Just measuring output. I would take a alcohol swab, I had one earlier, and I would clean it and stick it back in the little hole right there. Okay? And so then I would document, and I'm gonna leave it on a flat surface. I'm gonna document 335. 335. Y'all take a look. See the difference?
Oh yeah.
There's a difference in what this bag showed because the bag expands like that and like this. So it's going to be heavier and sink down because there's more surface space. This is where you need to measure from. Okay?
Makes sense.
And that's very simple. That's that. Next thing we're going to do is pericure. Oh, if a gentleman has his urinal at the bedside, I would never do any of this without gloves on, by the way. If he has his urinal there and I see it come in and I see that there's pee in there, if you ever walk in a patient's room and there's pee in their urinal, empty it, rinse it out, empty it, but measure it. And this is not the easiest. I'm going to pass it around. Okay. I think I'm kidding. And my eyes are horrible. So I didn't dump the whole thing in here. But I want y'all to pass around and look at the, I'll hold it for you. Use your hands. Now just pass that around. It is very hard to see. Somebody said the ones at the hospital are not that hard. That one's so, it's the contour of it. Okay.
If it is hard to see, pour it out into.
Yes, absolutely. So after I go and pour this out, I've measured it, I've documented it. Some people put it on the whiteboard in the patient's room. If not, they have an I&O flow sheet. Pour it out, rinse it out, and then leave it in the bathroom floor for the next time. If there's 2 patients in a room, write your patient's initials or something to designate who's it's who's. Okay, now we're gonna do pericare. We're gonna pretend this is a basin. They didn't give me one out, so it's pretend mode again. Okay, hand wash, gloves, clean gloves, clean gloves. So the first thing you're gonna do is you're gonna take a washcloth. You're gonna talk to your patient, introduce yourself, tell the patient that you're, gonna perform pericare before you insert their foley catheter. So the first place I do is I do the outside there. I go to a different area, I go down, I toss it. I don't put it on the floor, I put it in my little bag. Then I'm gonna start here, I'm gonna clean here, I'm gonna go there, I'm gonna go to a different area, I'm gonna go there, and I'm gonna drop it. You don't want it to be wet, you want to squeeze it out. Then I'm gonna open it up and I'm gonna go, actually I'm just showing y'all, I'm gonna go in between the labia minora and majora. I'm gonna clean there. I'm gonna go to a different area. I'm gonna go there. And then I'm gonna get into the clean one. And I'm gonna right down the center all the way from the clitoris to the anus. I'm done. I'll take this towel, I'm gonna pat her dry. Okay? Then I'm gonna get my bag. I'm gonna take it out of the bag. I have a hard time getting it back in there. Okay, so
Would you use that bag for your little trash
I
can?
don't.
Okay.
You can. I don't. I use this for my trash can. Okay? I'm good because it's the outside that's dirty touching my hand. But if I'm going to pretend that that didn't happen, and I'm going to act like that I'm undoing it, because it wouldn't have done that if it weren't used. Okay. So I did my hand sanitizer after I cleaned her. I pulled this open. Well, I don't. It should be going that way. Open away from you, side to side to me, and then I'm going to turn it like this. I'm going to do that because this, I don't want that touching, that breaks sterile technique right there. So I'm going to do it like that. My outer thing is an inch. First thing I'm going to do is put on my sterile gloves. So I'm going to bring it down here, get my sterile gloves, open them up. Remember, we have an inch. I put them in upside down. Okay. So the first thing you do is put them on using sterile technique. And these are not sterile gloves, so I'm gonna have a difficult time counting. And I'm sweaty.
This cop said it was a little small.
They are. Okay. Looking for my phone. All right. Remember, you can do it like this because I'm sterile to sterile. Now, I would have a lip on my sterile gloves where I could grab right there, right? And I don't. But I'm so sweaty that they're not wanting to move. But that's okay. I'm gonna take this and move it over to the side. I'm gonna put this on my bag, date and time it and initial it. All right, this first thing, as y'all remember, shiny side down, an inch all the way around is good. Okay, can I get you to lift your hips just a little bit? Okay, good. Now remember, I can go there. I'm not touching my patient. And I didn't go, I was within my inch border. This is a female, so I would not use the fenestrated drape at all. I toss it. Okay, I've got my lubricant, put it in there. I have my 3 swab sticks. What I'm gonna do is kind of get them out so I have more control of getting them. Right? This is gonna be trash because I'm not gonna get a urine sample. All right, then I'm gonna turn it, I'm gonna grab it, and I'm gonna come over here and sit it right there. I would have asked the patient to move her legs out further. Can you help me move her leg out further? So that we have more room. So I would have done that prior to. Then I'm gonna take this, I'm gonna move it up here, and I'm gonna come to this. I'm done with that table now, I'm just gonna shove it out of the way like that. This is the tricky part. A lot of people break sterile technique with this because they pull it off real fast, and then this flops around. Okay. Then I'm going to do this next. Okay, it's touching there. It's all sterile, so it does not matter. All right, I'm gonna drop that down. I'm gonna blue, blue, blue.
Is it still the same amount as it is with the male?
Same amount of lube.
Yeah.
The 5 to 7 inches.
Well, no, and the reason is their urethra is 8 inches long, and ours females are 1.5.
Oh.
So I don't do.
So
that.
just do the
I do about 2 inches.
2 inches, okay.
And then I'm gonna hope it stays in there because I don't want it to flop out. And I'm going to start with this. So I'm gonna open it as good as I can. I'm gonna go inside, all the way down, toss. Inside, inner labia, all the way down, toss. Y'all see how I'm not crossing my sterile field? I'm gonna go straight down the middle. All the way down, toss, go in the garbage. Okay. I'm gonna go straight. I'm losing my grip. I'm gonna go straight in. Urine is coming back. I see her urine, so I know it's in there. I shove a little bit I insert a little bit further after I see it, just a little, I'd say an inch. Then I'm gonna inflate the balloon. It's got 10 cc's. Do y'all see this hot flash? Oh, I'm sorry. I'm dripping.
I don't have your face, so.
All right, so I put all 10 in. I give it a little tug. I feel resistance. So now I'm done. I'm done with that. This hand's dirty. I don't even have to be sterile anymore. Sorry, I was about to drip. Then I'm going to take this, and I'm going to, this thing is made with a bigger side, and it might take a minute to figure out which side it is, because it fits directly into there, flat, and it will shut and snap. Okay, then you take the bag to an immovable part of the bed, exactly like we did the restraints. This little thing that hangs down, you hook it right there, and it's good to go. That's it. Pretty similar. So put it in there, and you don't pull. You never pull, because that is uncomfortable. You just put it in. See how I always use, I touch people. I use it as leverage. It's also comforting to them. And then I just pull it back. I'm gonna get my 10 cc's out. Okay, it's at 10 right now. Undo it. That's just trash. And okay, I'm gonna say, I didn't tell you that. Let me go back. I'm gonna have a washcloth. And I'm gonna say, okay, I'm gonna count to 3, take a deep breath in and blow out. And then as she's doing it, I'm gonna say 1, 2, and when I say 3, it's out. It's kind of a diversion tactic. I don't wait for her to blow out and expect it. I just do it. To me, taking it out is more painful than putting it in. And putting it in is a little uncomfortable. If it's been in there for a while, it kind of gets dry. All that lube dries up. So when you pull it out, it's kind of dry and feels like it's stuck. So when they're pulling it out, they're pulling it. I know, it makes me do like that too.
I keep getting the like back of the leg tingle.
I'm
thinking
telling you,
about it.
it is. That's uncomfortable. Okay, so any questions